So here's a child, 4 years old with watering gait. So we're going to move on to Coxa Vara just for a few minutes. And so Coxa Vara is a varus hip, and you can see here there's this sort of triangular cartilage that happens here. This is extreme varus. So the treatment for this is usually valgus osteotomies. In general, it's a decreased neck shaft angle with an ossification defect in the inferior aspect of the femoral neck. It's present, it's not very common, 1 in 25,000 live births. It can be bilateral in 1 out of 3 cases. And there is a differential diagnosis. You got to look for either an infection in childhood, trauma, SCFE, or Perthes in the older children. And there's a proximal femoral cartilage or physis ossification defect that leads to this. So you get a vertical shear and a varus deformity. There's no clear inheritance pattern, and it's kind of a slow stress fracture of the femoral neck. You have to look, it's either developmental, congenital, it can be acquired with infection or Perthes or SCFE. These are more the older children, infection in the younger child, some sort of bony dysplasia or cretinism. Again, you have previous trauma can cause it. The symptoms are usually a gait abnormality. They have a waddling gait. The trochanter is high, so they're mechanically disadvantaged, so they walk with a waddling gait. You can have excessive lumbar lordosis in those conditions, or if it's unilateral, a leg length discrepancy. And they'll have hip-restricted range of motion. The recommended views is an AP pelvis. And what we look for is a decreased neck shaft angle and this Hilgen-Reiner index. So here's Hilgen-Reiner's line right here. And then you look at the physis. So in this case, you'd have Hilgen-Reiner's line here, and then to the physis. This angle from here to here with the physis should be less than 30 degrees. In this case, it's 90 degrees, and this requires treatment. So anything normal is less than 25 degrees, not 30. So the Hilgen-Reiner's epiphyseal angle of greater than 25 degrees is what we see in Coxa Vara. And you also get this lucency like an inverted Y. You can get a CT to help with surgical planning or 3D reconstructions. I don't think that's as common in this age. So indications for treatment are anybody with 45 to 50 degrees of the Hilgen-Reiner's angle. The more severe ones will progress and probably recommend treatment. If they're less than 45, they may be unlikely to progress, but you got to watch those hips, and if it leads to a functional problem, then you probably recommend treatment, which would be a valgus osteotomy. So here's an angle, the Hilgen-Reiner physeal angle. So this line right here to this line is greater than 60 degrees. So you want to consider valgus treatment, get the neck shaft angle up to 150, and I like to do it with a blade plate, and you want this angle to be less than 30 or 25 degrees to prevent recurrence. And then you can use a hip spica cast if they're younger. So here's an example of a child with a severe Coxa Vara, and this is a case where we did a valgus osteotomy, getting the neck shaft angle to 140 degrees, and the Hilgen-Reiner's angle is 25. The other side was treated subsequently. You want to slightly overcorrect these hips. You can consider also epiphysiodesis of the greater trochanter, which may or may not have effect, or greater trochanter transfer when they're older. Complications, loss of correction, dysplasia of the acetabulum when you put it up in valgus or when it can't grow normally with a normal hip, premature closure of the physis, overgrowth of the proximal femur, or actually recurrence is another thing.
If you enjoyed this video, please consider leaving a like. We'd love to hear your thoughts and what you'd like to see next in the comments. Don't forget to subscribe to our channel and follow us on social media.